Is Rolfing painful? The short answer is no, Rolfing is not painful. If you feel pain, your natural response will be to withdraw from the stimulus and to contract your muscles so that they become tense and protective. And we don't want that to happen in a Rolfing session. We do want to reduce pain, and a good way to do that is to get to those really deep knots that may have been there for ages. They could be the result of old injuries. They could be the result of compensating balances for those injuries which haven't gone away even after years. They could also be the result of overuse, sitting at a computer in an awkward position with your head forward. And this is all treatable in Rolfing, but it needs to happen with your feeling safe at the time so that you don't withdraw and don't feel it as painful. And there are ways to work with that, working with breathing and asking you to meet the area, because there is a difference between pain and intensity. If something is intense, but you know or feel that it will do you some good in the long run, you're going to want to stay with that so that you can receive the treatment and get the benefit. And it should be remembered that Rolfing is really very good for reducing pain. The series is well constructed so that we can reorganize the myofascial dynamic that may be holding a vulnerable or tense area in place. Because it's never just in one place, it's always a place where you feel it, for example, the lower back, but it might be related to one of your feet, how your foot is connecting the ground, how that affects the knee, and how that in turn affects the opposite hip, which in turn affects your back. And the way the Rolfing series is put together, we can get all those areas relating to each other better and increase the chance significantly that that area will get stronger, more resilient, and the pain will go down. The other thing is that in order to get to those deep knots, we don't just push in straight away. We prepare your body for this by going from the superficial layers gradually in to the point where you can tolerate that intensity that's there sometimes when we touch those deep layers. And when that happens, if the area of, let's say in this example, your lower back is highly sensitive, which is causing the pain, by touching it and asking you to be present with your breath, with your attention, so that you don't withdraw because it's not too painful, it's just intense. By staying with it, this is a golden opportunity for a reset from your nervous system on the intensity level. So by staying with it, receiving the touch, that's a skilled touch to release that deep tension, your brain gets the message that actually this isn't as bad as we thought it was. This is actually something that can change. And from then on forward, it's quite possible that your pain will go down.